There are various forms of which the harm can be done to patients. Obviously, it can be because a mistake is made by an individual. More usually, it's because something has seriously gone wrong with a system that should be protecting the patient's safety. And it's not just a question of the physical harm that can be caused to patients. It can be an assault on their dignity. It can be a deprivation of humanity. So an elderly patient is left naked in their bed so all can see, covered in feces, which is one example I heard about, is a terrible way in which for someone to die. Almost as bad as the impact all that has on their loved ones. And then after that happens, the matter can be compounded by the system not listening to the people who've seen something dreadful happen, and not immediately dealing with their distress, their anger, rightful anger at what's gone wrong, and without actually dealing with the problem, which has obviously manifested itself in that way. So you end up not only with a harmed patient, but you can end up with a harmed family who then have to spend far too long trying to get things put right. And sometimes that goes on for so long that they're really not able to grieve properly. And so a system which is meant to be helping people get better, or at least preventing them from deteriorating in terms of their health, actually can end up harming a lot of people through even one incident. And clearly it's essential that all professionals involved do whatever they can to stop that happening. The first and most important point is recognising that something is going wrong and raising that concern. And that's something anyone in a team should be able to do, and they should be congratulated and valued for doing it. So whether it's the doctor, a nurse, a passing porter. One of the problems I found with Stafford was that really no one was taking their own personal responsibility for things. The sort of incident I've just mentioned, I don't think could have happened if people hadn't walked by the bed and not noticed what was going on, and if they had noticed, not stopping and doing something, instead of which I'm sure they all assumed it was someone else's problem. So that's the first point. The second point is that if nothing is done when you've raised a worry, you've actually got to carry on raising that worry until you are satisfied something is done. Don't assume that someone else is dealing with the problem. And thirdly, as a team, and by a team that could be the ward or it could be the management, you've got to make sure that the patient, if it's relevant, or their relatives, those who are caring in a proper sense for the patient, are involved in the learning process about putting things right. Because it's all very well doctors, nurses and assistants doing what they think is right, but actually at the end of the day, when things have gone wrong, you must take into account what the patient and their family think ought to be done. There's tremendous hope because, firstly, an awful lot of fantastic and committed and compassionate care is actually provided throughout the NHS. The story with Staffordshire, I'm afraid, isn't unique, and anyone who says that is, I'm afraid, misguided. But it's not the whole picture by any means. What really encourages me is the response to the shocking facts with Staffordshire and the system surrounding that hospital. Is the reaction of professionals who are both managerial and clinical and nursing, are really keen, the ones I meet, to actually get to change things, to change the culture so that people aren't afraid to speak out, to change the culture so that patients are involved, and to change the culture so that what's gone wrong is put right. And there are all sorts of different ways in which that can happen. And I'm also really encouraged by the steps that are being taken, which show to me that there is much more openness and transparency being put into the system. It's the ease with which poor care and unacceptable standards of care become acceptable. And that comes about through all sorts of reasons and not through intent at all. And I think it becomes too easy by habit to tolerate the intolerable. And I think that every day people need to think for themselves, what does this look like if I were a patient or the relative of a patient? And if everything was thought of far more often from the patient's point of view, I'm sure a lot of the horror of what has happened in some places would not have happened. I think there's just two words: be brave. They really encouraged me. They struck me as a bunch of really committed young professionals who want to do the right thing. And please, can I just plead with the system, don't crush that enthusiasm.